Hey everyone, I'm Dr. Josh Bletzinger. Happy New Year and welcome to this month's topic of immune health. So what I'm going to discuss today, and this video is going to piggyback on the article that is on my blog as well as what we're publishing here in the January newsletter. So however you got to this video, I don't want to take too much of your time, but ultimately give you the 3 concepts to help you understand your immune system and to help you make decisions on boosting your immunity naturally. So let's get started. Normal, healthy immune system. There is an initial response and there is an adaptive response. So initially, when your body becomes the harbor for some sort of invader, whether it's a virus, a bacteria, or a toxin, and God forbid, a tumor or anything more threatening than that, your body's going to create what you call an innate immune response. And this is just a knee-jerk reaction, and the body is going to sound the alarms. And the response, you're going to get fevers, you're going to get temperatures, upset stomach, and anything that this response happens where your body reacts to it, it is not an indication, contrary to popular belief, it is not an indication that your body is working wrong. It's actually an indication that your body is working right. It's sounding the alarms against the invader. Ultimately, what you want your immune system to do and your body to do is move into what you call an adaptive immune response. The adaptive immune response is a calculated and tailored, organized response to whatever the perpetrator is. So you sounded the alarms. We don't want to just turn the alarms off. We actually want to go and identify what has sounded the alarms. So we're going to send the right troops. In this case, it's the right immune response. What are we sending? Macrophages or neutrophils, lymphocytes? What type of immune response are we sending to the pathogen? There's 2 sides of the immune response that we want to address, and it's the T helper cell 1 side and it's the T helper cell 2 side. And ultimately, the end result is to get your body back into homeostasis. And homeostasis is just a physiologic fancy word for balancing the system, getting your body back into balance. And that's the immune system's job. So if we look a little bit more closely at the TH1 side versus the TH2 side, in a nutshell, what happens here is the TH1 side, we want to stimulate and mobilize the TH1 side against viral activity. Now, there's a lot more to it, but ultimately, for the case of the cold and the flu season, we want to look at the TH1 side as being mobilized against cells or against viruses. And so the interesting thing about viruses is that once they enter the body, what those viruses can do is they can bore into the cell. They can bore into the nucleus of the cell and start using your materials, your DNA, to manufacture and replicate itself. Ultimately, what you want to do to be able to nullify a virus from spreading is catch it when it starts to try and move cell to cell. So when it gets itself inside of the cell, there's really not much you can do except be able to control the symptoms. On the other side, so that's an inflammatory side. On the TH2 side, it's really an anti-inflammatory side. And you can see here that these are blood-mediated side. This is asthma, allergies, sinus issues, bacterial issues. And what we want to do is we want to create an anti-inflammatory effect. So that is the opposite side. And so in balance, your body is constantly trying to stimulate one side or the other to help you return to homeostasis. Concept number 2, immune stimulation versus immune modulation. That really gets onto the piggyback of the innate versus the adaptive response. So immune stimulation is a non-specific stimulation of our immune defenses. So ultimately what happens is that if you contract a cold or a virus or the flu and you get all these symptoms, the stimulatory side is to use something that is going to just pound the body down. Basically, it's going to kick you from one side of the curve to the other. You are trying to get rid of symptoms. You are stimulating the immune system to take some sort of response. Now, that's all good if we need to bring things down, or if the pathogen is advanced enough that we have to stimulate an immune response. But we don't ultimately want to keep you in a stimulatory response. We want to get into a modulated response, which is, and naturally from a homeopathic side, from a functional medicine side, we want to create intelligent intervention, and that is really getting the body back into balance. So a modulating effect is any effect that food or herbs in a combination will have on the immune system responsiveness. So which means we're going to go after the perpetrator. We're going to not just shut the alarms off. And we want to facilitate a very nice immune response that's flexible, and it's going to be calculated, and it's going to produce a multiple effect. So with this immune modulation, we don't want to just kick you from curb to curb. Or the other thing I like to tell patients is I like to say, you know what, because our practice here is really close to a major road called Randall. I don't want to just put you on Randall in your car, and I don't want to step on the accelerator all the way down to the floor and run through every red light and everything that we can do to get away from this stoplight, get away from this problem, and ultimately, without any calculation of this, run through every red light until we run into something else, or basically kick you from one curb to the other. Immune modulation is to ultimately just move you towards the middle of the road and keep you there. So we don't want to just bat you back and forth, back and forth. It's going to be a longer response. It's going to take a little bit longer. The response is intentional, but ultimately we want to get you to a point where you can fend for yourself, and you don't just kick something to the curb. You're going to defend it, and you're going to increase your body's innate capacity against that situation. And so when you look at modulation, there's three areas that we can focus on. There's the deep area of your body called the lymphoid lineage, and no medication is going to be able to get to this deep of your cell system. And so when you look at this, it's the chronic immune system issue where strengthening is required of your innate system cells. And I've also given you some examples here of what natural mediators can help at that deep level. The surface, the things that we know that you can find on a blood test, which is the neutrophils, the mastocytes, the eosinophils, the lymphocytes. So this is generally considered antimicrobials, okay, and will typically be used to interact directly with a virus or a bacteria. And as you can see here, here's some of the supplemental forms that will help at that surface area. And again, we're going to show you a little bit what's different between TH1 and TH2. The third level is the adaptogenic or the hormonal. So they affect immune system through hormonal reactions. And so some of these you might be known to you, like licorice or ashwagandha or ginsengs and melatonin, etc. So we want to use a combination of modulators to get you to a calculated effect. And so when you look at supplements, and so the third one here is that we want to use, but don't overuse, the correct modulators. And so if we're looking at viral patterns, and this is really generic, but viral patterns specifically, we want to look at supporting TH1 side of the immune system. And so what you can see here is you can see the supplemental modulators that are good for supporting the TH1 side of the immune system. So you have astragalus, you have reishi and maitake mushrooms, echinacea, licorice root, grapeseed extract, pomegranate, ashwagandha. And then you have on the other side TH2 supporting nutrients. And so interestingly enough, green tea, black tea, white tea, coffee, chocolate, these are foods, these are stimulators that we are using on a daily basis. And there's a lot of times I ask my patients, so if we're trying to balance the immune system, I ask, does tea or coffee or chocolate make you feel better? And in that case, it's yes. So if those questions are answered yes, I don't want to use more of those modulators to try and overstimulate that side of the immune system. And again, these aren't designed to be taken long term. We want to balance this system. We want to use things that are going to support antiviral activity or antibacterial activity, but ultimately that is going towards what we want to first and foremost do is understand the signs and symptoms. This is a viral reaction. Is this a bacterial reaction? What type of reaction is our body having? And ultimately, what are the pathogens? What are the intruders into the body? So we want to identify the triggers. So we want to look at lab, we want to look at lifestyle, we want to look at household products, chemical sensitivities, the season. So if we really identify triggers, this is the season right here, especially moving January, February, where you're going to get peak flu and viral and cold time of the year. So do we want to stimulate the TH1 side? Yes. Do we want to overstimulate it? No. We want to balance it. So ultimately, you can't avoid getting the flu. You can strengthen your system so you can combat the flu or a virus correctly. But ultimately, you're not going to be able to just avoid this. You know, getting the flu shot is ultimately going to give you some of the strains that might be protective, but the flu can mutate itself so rapidly that you can't catch all the strains. So ultimately what happens is that on a reactive side and a protective side, we're going to use things that are going to stimulate the immune system to help respond against these viral or bacterial infections and be able to get you back into balance. So ultimately what we want to do here is we want to modulate the immune system, and we don't want to stimulate the immune system. And so if we can help you with moving you along and getting balance back into the immune system, give us a call. We'll be happy to talk, look at some labs, get an understanding of what's going on, and help recommend some supplements that will get you into modulation so you can combat these infections in a calculated manner. So until February, keep it strong, do your best, and let us know if we can help. Talk to you soon.